This is an educational video to demonstrate proper phlebotomy techniques to draw a small volume of blood for the preparation of platelet-rich plasma. The first task is to assemble supplies for completing the blood draw. Obtain the following items from the Harvest APC procedure pack: blood draw syringe, IV needle, clamp, tourniquet, gauze pads, alcohol pads, betadine, and tape. You will also need gloves from your facility. Take the syringe that will be used for blood draw and load the syringe with the ACD provided in the kit. The ACD is an anticoagulant that prevents the blood from clotting in the syringe. If you are using a 60 ml disposable, 6 ml of ACD is loaded into the syringe. A 30 ml disposable requires 3 ml of ACD. Once all the supplies are gathered, bring in and seat the patient comfortably, preferably in a blood-drawing chair. Evaluate both of the patient's arms to identify the most appropriate access site. Position the patient's arm on an armrest, making sure that the arm is fully extended so as to form a relatively straight line from the shoulder to the wrist. To select a vein site, place a tourniquet or blood pressure cuff on the patient's arm. This will cause the veins to distend and make them easier to identify. Choose the vein that is most resilient and feels soft and spongy. Thrombosed veins may lack resilience, feel cord-like, and roll easily. These veins should be avoided. The bend of the elbow is the best place for needle insertion. Once the vein site has been identified, the venipuncture site has to be thoroughly cleansed. Gloves may be donned before or after the preparation step, but always before needle insertion. Use an alcohol preparation pad to cleanse the area by moving the pad in a circular motion from the center of the vein site outward. The area must be allowed to dry. Do not wipe with a sterile gauze, and do not fan or blow on the prepped area. If betadine is used, then it should be applied in a similar manner, using a circular motion. Betadine must also be allowed to air dry before it becomes effective. Never touch the venipuncture site after the skin has been cleansed. Ask the patient to make a fist so that the veins will become more prominent and easier to enter. Be sure to inspect the needle and syringe before performing the venipuncture. Make sure the tubing clamp is closed on the needle assembly tubing, or apply a clamp to the tubing before performing the venipuncture. If the needle comes in contact with anything other than the sterile site, it should be discarded and replaced. Fold the butterfly wings so that the textured side of the wings are between the thumb and index finger. Use the appropriate angle when inserting the needle. For superficial veins which can be seen and felt, use a 0 to 5 degree angle. With deeper veins, use a 5 to 15 degree angle. Avoid scooping or poking, which can result in site trauma or hematoma. Use your index finger to palpate and trace the path of the vein. Pull the needle cover off straight. Incorrect cover removal can damage the tip, which can cause trauma to the tissue upon insertion. Using your non-dominant hand, grasp the patient's arm firmly with your thumb below the aseptic area. Use your thumb to draw the skin back taut. The vein is entered with the bevel of the needle upward. Use a deliberate, quick motion when inserting the needle, keeping the proper angle. Do not go deep. The needle direction should always be pointing upward towards the shoulder. This is especially important when using the basilic vein. Stabilize the needle by placing tape on the tubing just below the wings. Prior to attaching the blood draw syringe, prime the line with the patient's blood. This will ensure that proper insertion was achieved within the lumen of the vein, as demonstrated by appropriate blood flow through the tubing. It will also minimize air in the syringe for a more accurate blood draw. To prime the line, release the tubing clamp and allow blood to fill the tubing to the luer connector, and then reclamp the line. Connect the syringe. Release the clamp and pull back slowly on the plunger until the desired amount of blood has been withdrawn. It is important when drawing with a syringe not to pull back too hard on the plunger. Excessive or aggressive pulling on the plunger will create high vacuum pressure. This can result in damaged or activated cells or may cause the vein to collapse, which limits blood withdrawal. When the desired volume of blood has been withdrawn, clamp the tubing. Once the tubing has been clamped, disconnect the syringe and gently invert the syringe several times to ensure proper mixing with the anticoagulant. After the blood has been successfully drawn, release the tourniquet and remember to anchor the needle with your gloved finger before removing the tape. When withdrawing the needle, place a folded gauze pad over the needle insertion site, and then slowly remove the needle by gently pulling back on the tubing using a straight, flat angle. Do not apply pressure on the gauze until the needle has been completely removed. Excessive pressure on the in-place needle may cause tissue damage. Once the needle is removed, apply pressure on the gauze for a few minutes before applying an adhesive dressing. Patients should not bend their arm following needle removal, since this action may result in a hematoma when the arm is finally straightened. Dispose of contaminated material and sharps in designated biohazard containers. Apply a pressure dressing after approximately 2 minutes.